So today we're going to talk about the big lie about frozen shoulder. We're going to go into some of the common reasons that this happens in the first place, as well as how does it present, and then we're going to go into the things that can mimic a frozen shoulder that a lot of times other healthcare providers completely miss. And when you miss this, you're basically treating the wrong thing and you're not going to get the result that you want. But it doesn't matter because frozen shoulder takes so long that you think, oh, that's why it's taking so long. But in reality, you could be treating the wrong thing. Hi, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications while getting their life back together. And we help people fit the pieces of the puzzle together. So many times when we go to a medical professional, they're just going to go to the side of the pain and go, okay, this is just what we need to do, when they don't really look at all the big picture of what are some of the other sources and another area that could be causing some of these problems. We always say where the side of the pain is often not where the source of the problem is coming from. And today when we talk about frozen shoulder, we're going to get into some of those things. So some of the common reasons that this happens. When we look at kind of the statistics, usually it's between, ages of 40 to 60 is when someone develops this. Usually they're women. There's also they typically have, what they say they typically have is diabetes, although the clients that we have seen that truly have frozen shoulder, I have not seen a single client that's had diabetes. But other risk factors could be thyroid, Parkinson's, heart disease. These are all things that can do this. And usually it's just an onset. It's just a gradual onset that just starts happening. No reason for it to happen. A lot of times it's the non-dominant side. Doesn't have to be. But these are some of the things that we see for how this happens. Now, how does it present? So when you look for frozen shoulder, basically what it is the capsule. The joint capsule has tightened around the joint, making it difficult to move the shoulder. So people have a lot of pain. A lot of times it can be constant pain. It just depends on what phase you are. There's a freezing phase and a thawing phase and then a recovery phase, essentially. And so it just really depends on which phase you are, and there can be a very, very painful phase. Now, when this happens, you'll notice like how we typically would diagnose someone would be they would have a capsular pattern. So what does that mean? So when the capsule's tight, there's a certain pattern that we see. And when we see this, we'll see movement loss. And so what we'll find is like rotation. Rotation is the worst. So external rotation, bringing the arm back, is way worse than internal rotation. That's part of the capsular pattern. But also abduction will be a little bit better than internal rotation, and then flexion is the best. So external rotation, bringing the arm back, the worst. The next worst is internal rotation, bringing the arm forward. The next worst is bringing the arm to the outside, and the last is being able to bring the arm up in front. So that's what we call a capsular pattern. And so when we check someone out and we move them passively through those motions, and we're noticing that potentially is what's going on, then we can start thinking, maybe this is a case of frozen shoulder. There's usually no onset of it. They're not really sure what they did. It's very common to other conditions that can mimic a frozen shoulder. So what are some of those conditions? Now, we'll have same kind of issues where they'll have limitations in range of motion. They won't always have a capsular pattern. Actually, rarely do they have a capsular pattern when there's other things that mimic it. But you can have things where they can't move the shoulder, they can't rotate the shoulder, but there's actually other things that are happening that's causing some of those things. One of those things that you have to look into is we've got to look at the neck. So the neck comes through here. There are muscles that attach into the neck, also attach to the shoulder. If something's not moving in the neck correctly, the muscles will protect, limiting your ability to move that shoulder. We've had cases where we had someone that had a rotator cuff tear, what they thought was a rotator cuff tear, had a hard time moving her shoulder, tried a lot, stem cell, tried injections, tried physical therapy, eventually decided, okay, I guess I have to have the surgery. After the surgery, she was really bad, couldn't move her shoulder, still 4 months of therapy, she barely could move her shoulder. And I told her, I was like, someone's missing something. And when she came in and she saw us, we went and we're like, we're going to rule out the neck. We just got to rule out the neck first. Did not have a lot of limitations in the neck, had a little bit of stiffness, but not a lot of limitations. But I kid you not, could barely move her arm up. And this was at the end of the day when she's more warmed up. We went and took her through a series of like retractions, retraction extensions, getting her to in range in that neck, and didn't think anything of it, didn't think we were going to find anything, just really wanted to rule it out because she didn't have a lot of limitations in her neck. Well, we did it, and it was like, oh my God, what did you do? I can move my arm. It feels fantastic now. These are things that we have to look at to go and make sure that, especially when it doesn't present as a capsular pattern, there's limitations of movement. The doctors, will eventually, that's what they'll say, like, oh, you just have frozen shoulder. We've seen it time and time again. And not often in our office is it really frozen shoulder. Usually it's something else. But we do get cases and we're like, nope, 100% believe this is frozen shoulder. But you have to rule out the neck as one of the things that can mimic a frozen shoulder. Another thing that can mimic a frozen shoulder is the thoracic spine. So when the thoracic spine is really rounded, it's going to be harder for us to move. It's going to be harder. Rotation can be limited. You can have weakness as well because now the shoulder blade can't move in and down. So when I move my arm up, that shoulder blade has to come down and in. And when it can't and it goes out, it's going to limit it. So I'm going to exaggerate it. The shoulder's forward. And that's as far as I can bring my shoulder up. When my shoulder's able to go down and back, now I'm able to bring it up much higher. And so these are things that we have to look at because it can limit that motion and give us the signs that this could potentially be something other than a frozen shoulder. So that's the second thing that can mimic a frozen shoulder. Now, a third thing that can mimic a frozen shoulder is what we call shoulder derangements. And what does that mean? We can be in certain patterns or we can be in positions like, for instance, rock climbing, playing volleyball, playing tennis, playing pickleball. We're moving the shoulder in a repetitive motion over and over again, repetitive motion over and over again. And so what can happen is we can get joint material such as bursas, fat pads, different things that can kind of get displaced and it can limit the motion. And we can take the shoulder in different positions, whether it's like if someone's rock climbing and they're holding, this is the position they're in all the time with a lot of force and holding their body up. I want to take them in the opposite direction. Maybe add a little rotation, maybe it just be full extension, but start doing repeated motions in the opposite direction to go and see if we can unlock that to improve that range of motion. If something truly is a derangement, it's going to be fast. We should be able to find a direction within 1 to 2 visits that we start making significant improvement in your range of motion. This will not happen with a frozen shoulder. So there's things that we can screen to see if it's really a frozen shoulder or if it's not a frozen shoulder. But it takes someone coming down and doing an assessment and figuring things out and not just getting a prescription from the doctor that says frozen shoulder. I'm like, okay, we're just going to do some frozen shoulder exercises and you're not really getting to the problem, the source of the problem, because maybe there's something else that's going on. So we like to rule all this stuff out because there's a lot of things that can mimic a frozen shoulder that is not a frozen shoulder. Now, in the next video that I will share, make sure you check it out. I will go over some of my common exercises that we give clients when they have a frozen shoulder to start working on moving that joint, moving the shoulder so that we can get some improvements as they're going through this whole entire process. So make sure you subscribe to our channel because we put out content all the time, and you can check out our next video which we're going to share some exercises when it really truly is a frozen shoulder. We're going to go through some exercises that you can start doing to start getting you some relief today.